Magnifico from Jared's Vet and Probably.com. This is Jerry. He is an indoor-outdoor neutered male cat, and he came in for lethargy. He is not really moving around. He's not eating, and they noticed a bump on his neck. So he's got a pretty firm, hard, palpable mass. It's about the size of a grape, you know, or a couple grapes together. So typically what we do is I do a full exam, look for any other masses anywhere. I'm always looking for lymph nodes, other signs of possible infection. With cats, especially if they're outdoor cats, abscess infection is probably the most common cause. He's also got a couple of scratches around the base of his ears, and he's on a flea preventative, so I don't think it's flea related, and his ears are nice and clean, so I don't think it's ear mites. So I'm going to shave up this mass, and we're going to take an aspirate and see if we can figure out what is in there. We always use clippers. Some cats are really hate clippers, so you got to be careful. Will you zoom in and I'll show you? So here is the reason that he is so upset. Can you come in here and I'll show you? So I shaved it up, and he has got purulent material, so he's got pus coming out of this wound. Can you see it? Mm-hmm. And now that I feel it, it feels like really hard and cheesy. So he's got an infection. For this, we're going to give him either an injectable antibiotic, and that antibiotic can last 7 to 10 days, or pills or liquid, but he definitely needs antibiotics for the next couple of days, at least, you know, maybe even 2 weeks while this drains. If this doesn't resolve completely, he will need a drain placed in there, because this goes from about here to here. We're also going to give him some sub-Q fluids to help with his fever, because he's got a fever. It's 103.5, and then probably something for pain and inflammation. So I usually give an injectable and set for a couple of days. If he is not eating and acting normally,